We're here on Carnivore Conversations with Dr. Rob Kiltz and Dr. Tara Harding, and I'm really excited to be here talking about women's health care. And maybe you could start off, Tara, tell us a little bit about yourself, and I'll then share a little bit about myself. But
Yeah.
beautiful ladies first.
Oh, I thank you. I'm honored to be here. So, I feel like my story actually is like many. I'm a doctorate nurse practitioner, but I went through infertility as a healthcare provider. So, I had this very, I feel like, interesting look at the inside of what patients go through. And when I went through it, so my son is an IVF baby, he just turned 6. Of course, no insurance coverage. I was working rural healthcare in a small rural town, and we did not talk about this, right? So the whole stigma thing totally applied to my story.
Wow.
So much as like I didn't even tell people in my office, and there were 6 of us. And so I tiptoed around until I couldn't tiptoe anymore and was like, I need someone to take call for me. I did ER coverage at the time, and I'm doing infertility treatments, and I can't tell you when or when I'm not going to be here until my cycle starts. So here's the story. And I pivoted into this whole place of it. Actually started. I started a nonprofit. There's no nonprofits. There was no support groups when I was going through this. There's no insurance coverage, and so I really dove in after my son was born on that level, getting resources financially, mental health at a state level, at a local level. And then it turned into, wait a minute, this is my passion. And I started my business with just telemedicine. So from the basement of my home,
Wow.
yeah, rural North Dakota, started out of my home. And it just has grown now to brick and mortar, women's health, fertility. I even hired pediatric lactation, men's health, and I've just really pivoted what healthcare looks like in our practice. It's not your average healthcare setting. You get lots of time with us. You get full control of your healthcare with no judgment. If you want supplements, you get them. What labs do you want? You get them. We might even have more that we can do. And so, really, just changing our environment is usually lamps, low lighting, couches, that kind of like a coffee shop music setting out in the
Mm-hmm.
waiting room. And just really changing that, because what I saw happen even on telemed was when women especially are in their home environment or a comfortable environment, they open up more. And so how can we change that to when they come in here to feel a little different too, so that they open up more as well? And so it really just stemmed from my own, I was medically gaslit as a patient, going through miscarriage, and I just was like, what is happening? Like, this is just awful all the way around, and how can I change that one patient at a time?
Well, so what was the impetus that brought you into healthcare in the first place, and what's broken, and what can we do all to be better in fixing it?
Yeah, so my healthcare, how I got into healthcare as an RN first, I truly believe goes back to my neighbor's dog needed insulin shots, and I watered their plants and gave their dog insulin shots. And I was honestly probably like 12 at the time. And then it transitioned to I was a volunteer ambulance driver in high school because I got out of school. And I got this like adrenaline rush then, and went into EMT class. And then that, of course, became an RN, and then came nurse practitioner, and went home to serve my rural community for over 10 years and give back in that way. And then my story happened, and it's just pivoted from there. What's wrong with healthcare? Oh, goodness. Can we not just believe a patient when they say they have a symptom? Like, is it so hard to believe a female patient that maybe her fatigue isn't due to stress and anxiety? Maybe her weight gain or weight loss isn't due to mental health. Maybe there's actually something physical going on, or maybe unexplained infertility isn't unexplained and there's a reason for it that hasn't been found yet. Like, why is it so hard to believe that? I've been honored to be part of some medical gaslighting like studies and articles, and it's like
Hmm.
women are diagnosed with cancer 4 years later than men. Women get less pain meds in the ER than men. When women present with physical symptoms, they're being sent 4 times more to mental health services than men. Like, what is with that, and how can I help raise awareness to healthcare providers, talk on my platform and use my voice, but also change that at a healthcare level too?
What do you think is the underlying cause of our problems.
Yeah, I think healthcare providers are uneducated. They just haven't updated their toolbox, their knowledge bank. They haven't been to a especially in fertility. Like they're doing fertility treatments, but when was the last time they attended a continuing education or a conference or a summit on fertility? I think it's lack of their understanding or personal belief systems getting in the way of what's actually out there. And just because you don't believe in a supplement, I just use supplements all the time because they're so ragged on, like as being, they don't help, they don't work, there's no research, blah, 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 insert whatever. It's like, just because you think that doesn't mean the patient can't use that option and do that. So I think a lot of personal opinions, egos, biases, lack of education totally gets in the way of how they're projecting their own stuff onto that patient.
I've always thought in medicine is I'm the doctor and I know the answers, and you don't, and listen and I will tell you what to do, rather than us listening. And I always say, if we listen, we learn, and there's a way to find a solution to everything, because but we don't have enough time in healthcare the way it's currently run. And so it's, I've got a problem, you're going to diagnose it and give me a drug, and off we go. And then often whether or not you either use those medications or you get a solution from it, but there's a lot of frustration that maybe you never want to even go back there.
Nailed it. I see that all the time. And I think that's like that is probably the high level overarching thing, is just the way the system is set up. And so I just created my own system, I guess. I don't know. But like it is like the time spent and the rush. And they probably, honestly, I bet most healthcare providers don't get a lot of time off to even go do a continuing education. Again, a systemic issue. But it's the thing that I always say to providers is there's this really weird and neat and fun thing nowadays called the internet and social media. Shocker. And patients are on it and they're learning from other healthcare providers such as you and I, who are out there putting that information out there. They're learning and hearing other things and seeing what's going on outside of their region and their network and their healthcare system. And it is, I feel, the provider's job to say, hey, you know what? I'm not sure on that. I can't be your be all end all. I might not have the answer, but let's find somebody and grow your team. Add to your team who is. And let's grow who is on your healthcare team versus me having to be the only one that knows absolutely everything, or else it's not Bible. It's like, I don't hold all the answers. Let's grow your team to see who might know those answers.
So do you think that the telehealth is a plus in healthcare, and how can we utilize it better and improve healthcare in general?
I absolutely do. I often say it's like, if there was one good thing to come out of the C word of COVID, it was that.
Yeah.
It was being able to provide access. So of course, being where my journey started in rural healthcare. Wow. Like, if we just go from a micro level of telemed, being able to provide services into underserved populations alone, telemedicine does wonderful things. But me being able to get multi-state license, I'm licensed in 3 states right now and growing more. I can even provide a service in other states and where patients can use their healthcare insurance where they might not be able to travel to me. Or looking at what the demographic is, especially in my region of the Midwest, there's a lot of farmers. And so I always share fun stories of men and women. I've had men and women who work on the farm. They will do their telemed with me and they're literally out pounding fence posts or delivering a baby calf. And they can quickly take a minute for their healthcare, or 5. And I can get them services that they don't have to leave their setting, or the female who's laying in bed and sharing so much of her personal story with me. She can do that from the comfort of her home. Don't have to leave work. Husband's at work in the oil field. He can jump onto the telemed appointment with the female at her job or at home, and they can all be involved in this plan of care that only telemedicine could probably bring that together, where they don't have to have that burden of leaving work, home, or the inability to travel. Cost being the barrier to traveling to providers is really being able to reach way more providers across the country via telemedicine.
So you're primarily focused on reproductive medicine, women's health care. Is that true?
That is my niche.
And how do you integrate Eastern medicine and other holistic health modalities? And if you are, tell us a little bit of how you're implementing that.
Yes, I definitely do. I think that's especially the unique thing about in my area is not there's not providers that believe or do both of that. Or they'll be like, you take insurance and you can like talk to me about supplements even. And I'm like, yes, yes, we can. So really, again, I'm a root causer. Like, what is there? If we can find a root cause to what's going on, what is it? And with reproduction too, I'm like, has the male been checked? I can't tell you how many times they're walking in and that male's never been tested, and they've been trying for 2 years. Everything's normal with the female, or been worked up front, back, and sideways with that female, and he's never been checked. But the integrative side is I love acupuncture. That is one that I'm huge on, and I'm making sure, like, hey, have you thought of this? I'm educating them on their other options: chiropractic, pelvic floor physical therapy, supplements. I usually, there's of course me becoming and training my staff as well on supplements and the importance of them and how they can be utilized in interactions that we need to be aware of, and when do we start them, when do we stop them. And so I'm really building that into my trainers providing too, because we do know there's benefits to those things. And there is other things we can do aside from just prescription medications too. And really we bring that in, and patients love that. That is like the way of medicine right now. I feel like they want someone who has some alternative options and isn't just pushing the prescription pad too. So we do believe in this really, high level team approach. Who else do we need to bring in? Who needs to be part of your team, especially mental health? Like, in my mental health provider who I hired as well is very trained in both sides too. And polypharmacy, can we pull some of this off as well, and really root cause, deal with the traumas? What are some other people on the trauma side of it that we need to bring on as well when it comes to mental health?
Well, how do we address mental health as because often it's sort of pushed to you got an emotional mental problem, and we treat it differently than we would a physical problem. How can we get better at that?
Yeah, so I just talked about this morning actually on the news because it's Women's Health Awareness Month right now. But it's why can we not do physical and mental at the same time? They should just be right beside each other, equally as important, where we need to be addressing mental and the physical. And I think it starts with, like, again, I just try to break those stigmas down and really just open up conversations with patients, with other providers, and say you can address the mental and the physical and be diving in and doing diagnostic studies and labs and alternative lab testing, and they can be seeing all of the people for their team at one time, not wait for this and then this and then this. It's more of the side by side notion. I think we need to really, when it comes to mental health too, it's like we have to deal with the traumas. I love EMDR. I love hypnotherapy. I'm always bringing that into my patient's care
Mhm.
plan. Counseling, therapy, all of it. Really, again, where did it come from? What is the cause of this? How can we work with that? Because it does cause physical symptoms too if we don't address that.
Well, the brain is essentially another organ that's damaged by something. And so it's not unique and different out there, not part of the human body. So if our reproductive organs or other other organs are damaged, the brain is equally likely to get damaged. And our, our emotional, mental, physical abnormalities are all related and intertwined.
Absolutely. I always say the head's not rolling around over here. It's
Yeah.
connected to the
Yeah,
whole.
yeah,
It's
yeah.
all connected.
And tell us a little bit about focusing on education for your staff. How can we help our team members gain better knowledge and insight into all these things?
I just got done with a staff meeting. We just had a 3 hour. Once a month we put aside time and pull aside to have deeper sessions, whether it's what's going on within the business, process improvement stuff, but mostly education stuff too. And I provide them with alternative CEs and webinars and trainings. So I actually do send them to a lot of Eastern and Western medicine, both. They're going to both. They're learning about both sides of it. And then we're having conversations. And I actually take a lot of students too, because I'm passionate about it. It has to start there. They're getting one side of the story. There's a whole other side of story over here. And they'll be with me for 1 week and be like, I feel like I just learned more than I did with like 300 hours of a book, and it's like, welcome, like, welcome to the other side of medicine over here. But I think it should actually go back to schooling, because when I grab those nurse practitioners or PAs books that they're learning from, I'm like, here's the problem, actually. Like, this is a problem.
Well, the books are science that may be wrong in many ways, and we're missing apprenticeships in our communities, in my opinion. And really, we all need to be getting out there and working with someone that's been doing it. Maybe spend more years doing that than we are crammed into undergrad and medical school, and then we get out there, and then it's once again it's a fire hose of knowledge that, quite frankly, most of it is irrelevant.
Absolutely. You nailed it. 100%.
I mean, we're learning all the science, and quite, as I said, it doesn't help us when we're trying to communicate with our patients and understand what they're going through, and recognize that we too, as healthcare practitioners, have many of the same problems.
Yeah. So that's what I usually say. I'm like, I am you, you are me. Like, I am no different. And I'm back in the chair again of endometriosis and infertility as my patients are. And so it's just, we're all patients at some point in our life. Like, and if you're not, like, props to you. But like, that is exactly, I think I had to go through a lot of stuff to change and help my patients too and see that side of it.
Well, I know for myself, it wasn't until I was sick and not getting well on standard treatment where I began to dive into meditation and prayer and yoga and acupuncture, massage. I began to do retreats that were critical on understanding and learning more about these modalities, doing herbal medicine and essential oils that I found like, wow, I got some benefit from that.
Same, absolutely same story. And it's one thing too that I've like continued and carried on, because I was like, your reproductive story is a snapshot in your life. What happens at other stages and other times, and when your husband or your children are going through healthcare experiences too, you can pull a lot of those tools over in to help them too, or help you in other areas like meditation and prayer and oils. Like, when I went through job changes or hard times with work or a divorce, I was pulling tools, hypnotherapy, mental health, supplements, because I knew my cortisol was up. Like, I was pulling those tools I learned in the first half, I call it stage one of my reproductive story, and now I'm using them again too. So yeah, everything you learn, it should be a full body approach to all aspects of your healthcare. And they're not trained in that. That's not being talked about in the books. And they can learn that in apprenticeship and job shadowing and rotations that are unique. How we do IUIs, the process that we use for sperm wash, no one's doing. And we're the only ones doing it. So, and it's really just talking and being involved again in the reproductive space and talking to amazing providers like you and going to the conferences, talking to the vendors. We can now start doing, HSGs in office and things like that are just not being done or talked about. I'm like, let's go. How do I start this? How do I train my staff on it? It makes sense. Done the research. Let's do it.
Tell us a little bit about your thoughts on nutrition and how important nutrition is. And as you know, my craziness on nutrition focuses on keto and carnivore. I think that's one of the primary issues that we're all suffering from. But what's your train of thought, and how do you approach it?
I would agree with that. How do we, again, we just talked about the brain being connected. Well, the gut is how much of our system connected, and our whole process from the time we eat food to it's expelled is huge. Like, that's huge part of our bodily system and hormones and the impact on, and there's enough out there nowadays to support nutrition, hormones, reproductive, etc. So it has to be, you can't just keep doing the poor lifestyle and expect fertility to not be impacted by it. It has to be part of it, and a huge part of it. And we have to start talking about that more too. And protein is a huge thing. We do talk about that. My dream is to have a dietitian in my practice at some point too, to help with that side of it. But it's, again, protein and increasing that and the understanding of that, and setting them up with a plan for success too, and just talking about it and not food shaming, and really, okay, if they have emotional ties to food, which will come out a lot, we need to bring in help for you for that too. That's a real thing, like the emotional aspect to eating and fixing that. Is your cortisol through the roof? Is your insulin through the roof? Like, we need to be working on that while trying to conceive, and really focusing on that part of it while trying to conceive as well. And it's talked about at every visit that we do.
One of the things I think is a problem is we shame women for their size,
Mm-hmm.
and especially obesity, but certainly if you're extra lean.
Yep.
What can we do to remove the negativity and judgment that we in healthcare are giving to our beautiful women of all sizes? And because again, that they're always worried that someone's going to put them on a diet, they got to lose weight.
Yep.
And I know we see many patients because their BMIs are high, and many people will not even take care of them because of their BMIs.
Oh yes, that's the common theme I see as well. I just talked about that again in my staff meeting. So we don't use the word diet. Like, never should we ever say the word diet. These are lifestyle changes. We're talking about your nutrition. We're talking about your movement, and really like changing that verbiage of when it's coming out, how you're approaching the patient. It drives me nutty. Like, I actually like hug patients so much when they're like, well, my provider just told me if I just lost weight or gained weight, this will be resolved and fixed. That has got to end. And then they send them out the door and don't teach them one thing even. If you're going to say that, you better back it with some education, handouts, education session, resources, or a referral, or stop saying that. It's got to change in the healthcare verbiage and system, or again, it's on the healthcare provider. And then again, if I'm catching a patient who, it's so amazing and I feel so honored when they open up to me and they're like, I've struggled with food since high school. I can pin it back. This happened yesterday to the bully in 4th grade who bullied me on my size. And I was like, I hear you. I see you. That is still a real issue now. Let's bring in some additional members to your team to help with that now. Like, we are still going to attack the 4th grade bully that's bothered you now at age 24.
It's still bothering you.
It's still bothering you. And
Yeah.
I believe you. And we need to work on that. That is a real issue at hand today. So I brought in resources and services for that. It's got to change again at the healthcare provider level. But I want to inspire the patient themselves and the female themselves. I can sit here all day long and be like, please love yourself. You're amazing. But it's like, we need to rule out, when did that happen? A lot of it too. My mom had an eating disorder. My mom's a 90s mom, they'll say. And I am ruined of food because of how my mom was ruined of food and diet and the word, restrictive diets. And they're all impacted by that now. Thank you for sharing that. Let's work on that. It's really finding them additional team members to bring in and resources that can help them with that, because it's a very real thing.
And the biggest problem is time to talk.
Yep.
And most healthcare practices don't provide that.
Right.
And are you primarily an insurance reimbursed clinic?
I actually am. I actually am primarily that. And we bill on time now. So to that, I tell providers too, there's almost little to no excuse, unless your system is ramming you with, you need this many people and RVUs. I've really changed how my providers get paid and reimbursed as well from that level, to get that rush mentality out of them and the listen and time mentality into them.
And what do we do to change maybe the health insurance systems to recognize how important it is to provide the time rather than sweep them in and sweep them out?
I love that question, and I get kind of like internally worked up because I have worked with insurance companies for over 6 years now, particularly on infertility benefits, but also I was our state nurse practitioner legislative liaison. And I just, they are money focused, and I don't know how to change them. They are so money focused, and it's ruining healthcare. They are a huge, if not the main part of the healthcare problem is the insurance company. What the patient pays for deductible, what the patient pays for premium. Now healthcare, mental health isn't even fully covered anymore, and we're dealing with that internally. People are trying to pick, do I come see you or do I go to my mental health appointment because my deductible is $6,000 and I can't afford that anymore. They are the problem with this too. And so, yes, reimbursement for me as a provider is a problem. I can work through that, but they are making patients pick and choose and halt getting healthcare acts. Like, they're just not going to go in. Like, we're just going to see patients now stop going in for preventative stuff and other cares as well because they can't afford their deductible.
Well, I'm just wondering if we need to see a complete shift because our health insurance costs are excessive.
Yeah.
But the question is, are we getting the very basics that we really need? And since we're all getting sick, and the answer is, well, we don't know why. And maybe if we begin to focus more on the natural health and wellness that our body wants to be in through our mindset, our nutrition, and fit motion, we will improve our overall health and wellness, and then not need the extensive health care costs, because people are taking drugs for weight loss and all sorts of things, dissections for these things also, where if we change our mindset, change our nutrition, we will significantly lower those costs, feel better, and not need the expensive day-to-day healthcare, but maybe just have some basic emergency care, and that might be mostly what we need.
I absolutely agree 100%. It's to the point now, I say in 2024, where it's like almost so obvious that they don't care that you're sick anymore. Like, when they're pulling out what their coverage is for preventative and how much they cover and what they are covering and not covering, it's almost obvious that they care more about you when you're sick. And so that's the sad part.
Well, there's a journal called the United States Department of Agriculture's Journal on Plant Poisoning. And so the livestock that eat the plants actually get sick on the plants. And they want to know this because if their animals are getting sick on the plants, they lose money. But when we get sick, for whatever reason, someone makes money. And there's really no incentive because ultimately the healthcare costs are just passed right on to the consumer. And there's little to no control, and it's going up and up and up. And so if I'm giving the advice of how to be healthy, and I'm just wondering whether or not that advice that we're getting from our experts is accurate, true, and maybe leading us to being sick.
Yep. You've got me. If there's been one thing since I've started following and reading more on what you're saying, I'm like eye-opened as well. Like, what are we not being told, and what do we all need to learn yet as consumers and as the patient? Like, that is where patients, I always say you almost have to you're going to get a degree in healthcare because you're going to have to go and learn a lot of this on your own. You just do.
Well, ultimately, the individual needs to be their very best healthcare provider and learn the information. And the beauty is the information is online.
Yep.
And you could go to medical school online pretty much. Yep. And what you're learning is a lot of the non-traditional ideas that are opening up our eyes to the possibility that it's opposite of what we're taught in medical school, residency, and beyond.
And patients are waking up to that. And it actually makes me happy for them because it aligns too, with things that you and I are saying. I've had a student ask me, she's like, what makes them believe you over the other people? I go, because what I'm speaking and saying is aligning with what they're seeing on the internet and social media. And that's what is going on in the country and globally. They're aligning with those things, and I'm aligning with those things.
Dr. Rob Kiltz, another beautiful, spectacular day. And I just want to send thanks to all those for watching the newest episode of Carnivore Conversations. Be sure to follow us on Spotify, Apple Music, and other streaming platforms to gain access to the full 1-hour episode. And don't forget to like and subscribe for more to come. God bless.